These are the top 4 viruses wreaking absolute havoc in the pediatric ER right now. Number 4 is Croup, most likely para-influenza virus. This makes kids have like a little bit of cough, runny nose, and they wake up in the middle of the night absolutely short of breath, barking, super scary. By the time you get to the hospital, most of the time they're doing better. We give a dose of steroids, but sometimes they need a special breathing treatment called racemic epinephrine, but we've been seeing a lot of these. Number 3 is Rhino/enterovirus. This is a family of viruses that can do lots of different things, but we're seeing a lot of respiratory stuff. Cough, runny nose. Some of them look like bronchiolitics with the wheezing, difficulty breathing. The ones who get admitted with this generally look like bronchiolitics and they're needing some respiratory support. Number 2 is influenza, mostly influenza A. These kids are also really miserable. They look terrible. Cough, fever, runny nose, fatigue. It's lasting kind of a long time, 4, 5, 6, 7 days. They're having fever, body aches, vomiting, diarrhea. They're just puny. So we're having to give a lot of fluids. We're seeing a little bit of myositis, which is like really bad leg pain, so they don't want to walk. Checking some labs for those usually. But these kids are not feeling well. Number 1 is RSV. We were seeing a little bit of it, but it is definitely here now. Mostly younger infants and toddlers. The older kids typically have some underlying like asthma or breathing problems. Cough, wheezing, fever, some vomiting, some diarrhea. They just look terrible. A lot of suctioning, but they're still like coughing, gagging on all of that mucus. Having to admit a lot of the kids, which means that the hospital is starting to get busier. I usually do top 5, but I only did top 4 today because we're seeing a little bit of adeno, a little bit of human metapneumo, and a little bit of norovirus, and none of them were more than the other really, so I just went with top 4, but there are some other like honorable mentions. Addressing the comments that I will inevitably get on this video, what happened to the common cold? Technology has advanced and we gave it a name. We used to call it a cold, now we call it enterovirus, rhinovirus, RSV. We just gave it a name. Are these kids vaccinated? No. I have not had one this year that has RSV that got one of the monoclonal antibodies or mom had been vaccinated. It's still early in the season. There will be breakthrough cases. Have I seen a flu yet that's been vaccinated? No. It's still pretty early in the season and a lot of kids in Florida just don't get vaccinated for it. Your doctor only swabbed for flu, RSV, COVID. How do we know about some of these other viruses? We do have more extensive panels in the hospital. We use in only certain patient populations or if it will change the management. So in patients that have transplants, immunodeficiency, or they're really, really sick, we can do this expensive panel, but it costs a few $1,000s. And in most kids that are going to go home and are otherwise healthy, we can just do flu, RSV, COVID. It's not going to change the management in most kids, so we don't do it.